Hello, I'm Acting Commissioner Tricia Ford. In advance of the November 5th Town Hall meeting hosted by MSAD, I'd like to share a brief update on the work that the Commission has been doing. The Commission has received tremendous support from Health and Human Services Secretary Mary Lou Sutters, Governor Baker, and Lieutenant Governor Polito. And as Acting Commissioner, I am truly appreciative of all of their support. The past 8 months have been difficult for all of us with the impact of the COVID-19 pandemic, and MCDHH has worked to support inclusive communication access from the Governor's Office at the local level, with sustained participation from the Boston Mayor's Office, Worcester, and Springfield since the pandemic began in March. We have all shared commitment in communication access for our deaf and hard of hearing consumers. This commitment is supported with the release of Governor Baker's revised budget, which contains an increase for MCDHH. Governor Baker's revised budget proposal recommends $6.8 million, an increase of 12% over FY20 budget. This budget supports MCDHH's programs and services, including 1. Expanding the pool of CART providers and qualified sign language interpreters in the Commonwealth. 2. Promotion of bilingual, bicultural approach in competency in ASL. 3. Collaboration with and review of post-secondary interpreter preparation and CART provider training programs. 4. Level support for deaf and hard of hearing IL centers, interpreter CART referral, case management and social services, and communication access technology and training services, all level funded. As with all agencies across the Executive Office of Health and Human Services, over the past 8 months, the Commission has been focused on pivoting to provide services to individuals across the Commonwealth in the face of the pandemic, as well as we've been creating and disseminating information about the COVID-19 pandemic for our community. MCDHH has provided interpreters for media briefings from the Governor's Office, the City of Boston, and Springfield since March 9th to the present. This is so that people who are deaf and hard of hearing can access vital, time-sensitive information. We have received almost 700 requests, 1,285 interpreting hours, with a fill rate between 83 and 96%. We are working with community members, including the Federation for Children with Special Needs and the Special Education Advocacy Network, to provide support and guidance to families and to create linkages to the MCDHH children's specialists to improve special education instruction for children during the pandemic. Several statewide webinars were created and are hosted online at the Special Education Advocacy Network's website. Case management and independent living services have been moved almost entirely remotely, to ensure that our most vulnerable citizens continue to receive services and supports and remain safe during this challenging time. Communication Access, Training, and Technology Services, affectionately known as our CATS department, has successfully continued remotely and has supported healthcare facilities and community organizations to communicate critical information to our community. For example, Stewart Hospitals translated the COVID-19 card into 9 foreign spoken languages. To date, the card has received 75,000 views on social media, is in use by medical professionals and deaf organizations in 20 different states, and also is used in 5 different countries outside the U.S. And also it's been used at both the state and national deaf organizations and within the medical community. Workforce development projects continue despite challenges. This includes our interpreter screening program, our graduate to certification program for interpreters, our state agency mentorship program, and ongoing participation in statewide work groups for interpreter training programs in Massachusetts. Also, the community asked the Commission to continue to develop and release vlogs, which we have done on a range of topics. This includes Hispanic heritage, recovery coaching, Black Lives Matter, remote interpreting, and safe sex vlogs. Those have all recently been shared with the community. Also, earlier this week, we released the job announcement for MCDHH commissioner position. We are also partnering with other agencies to support their efforts to communicate in ASL with our community on topics, for example, like the flu vaccine, the COVID-19 contact tracing, and next week we will release information on an RFR for vlog and video creation. This RFR will allow more vendors to work with state agencies to provide access for our deaf and hard of hearing community. As always, we welcome the community to alert us to what information they feel is most needed, and we also continue to rely on our statewide advisory council members for their input. The Commission is working to increase understanding and cultural awareness among our staff, and we have participated in EOHS offering training as well as ongoing efforts with human resources to increase our retention and inclusion for recruitment, promotional opportunities, and professional development. Diversity and representation of MCDHH staff is a priority. 70% of the management at the Commission identifies as deaf and hard of hearing, and approximately 40% of our staff identifies also as deaf or hard of hearing. Those statistics are good, but at the same time, we are committed to enhancing this representation and encourage members of our community to apply for any open staff positions. Our Human Resources Manager, Karen Eddy, provides a comprehensive update on these positions at the State Advisory Council SAC meeting, and all positions are also posted on mass.gov. MCDHH continues to work and coordinate with our sister agencies every day on issues that impact our community. Just this week, our team engaged with Massachusetts Commission for the Blind on issues that we can work together on to provide services to our deafblind community. As we continue to navigate the pandemic and eventually recover from its impact, I am looking forward to your continued input and collaboration so that we can best serve our deaf and hard of hearing residents of Massachusetts. I look forward to engaging with you at the town hall and will be available to answer any further questions. Please stay healthy and safe. Thank you.